Hi everyone, welcome back to another episode of Radical Radiographic Positioning. As always, your host Alex Chan and my co-host
Mel.
And we're here to present the
Coyle method.
And so for any of you that don't know, the Coyle method is a exam to evaluate the radial head of the radius. And so Mel, why do we do the Coyle method?
We do the Coyle method because we are concerned with a possible radial head fracture, and the patient usually cannot fully extend their arm for protocols to get the lateral oblique. So we angle the tube to get a better visual of the radial head.
Mel, that's absolutely right. So the reason why we are angling the tube is to take advantage of the elongation of that tube angle into the forearm.
And we're back. So what we'd like to do here is we have Charlie, and we'd like to demonstrate to you what we're looking for the possible radial head fracture.
Correct. So as Mel was saying, typically the arm is not going to be fully abducted. So we're going to take advantage of that by angling the tube. So as you can see here, our area of interest is going to be the radial head and then the coronoid process of the ulna. Hi again everyone. Again, so the reason why we would be performing this examination, the Coyle method, is typically when there's a suspicion for a radial head fracture. With that being said, the suspicion would be caused by an inability to rotate or supinate the hand, difficulty fully extending or abducting the arm, and then if there is a history of elbow trauma, which would cause swelling in the elbow joint and pain outside the elbow. This is most common, these injuries are most common when a patient tries to brace their fall forward, cracking the radial head.
Alright, and now we are going to demonstrate how to find the technical factors in this room. Since the tube is all set up at the correct angle, you're going to take your calipers and you're going to measure where the beam is going through, which is going to be the oblique angle. So we're looking at a 12. Once we get that, we go ahead and go over to the chart and we look for the elbow oblique. So we have 70 for the KVP. Scroll over to 12 and we have 2.2 for the mass. We're going to come down here and input that. What do we say? 70 and 2.2. 2.5 is as close as we can get. Just a little side note. Because we're using the oblique plane for every image position that we're shooting, we're going to use the oblique elbow technique from this chart in this room.
Hi, Miss Maguya.
Yep.
Hi, my name's Alex. I'll be taking your x-ray today.
All right, awesome.
Excellent. So we're going to go ahead and skip the general formalities and we're just going to go into the positioning of it.
Sounds good.
So Mel, why don't you go ahead and take a seat here.
Okay.
And so like we said, in concern, we need to evaluate to ensure that the patient in the seated position is able to extend the arm about the height of the shoulder. So the table's going to be moving up, okay, Mel?
Okay.
Again, we bring up that that exam table to the height of the shoulder, and that is the max. So, as you can see, Mel's hand is at a 90-degree angle to her body. And so for this image, we're going to be angling the CR 45 degrees internally to elongate that radial head. Our centering point is going to be the mid-shoulder joint. So as you can see, it's going to be about midway between the shoulder crease, the elbow crease, and the olecranon process. Good. Our SID should always be 40, even though Merrill states that to increase spatial resolution, your SID should be 44 to 48 degrees. So as you can see, we're centered on the radial head. We have a nice open collimation. I'm going to place our marker on the lateral border and ensure we shield our patient. For our next seated position, we're going to be visualizing the coronoid process. So there's slight deviations from the radial head imaging of the Coyle method. For the coronoid process, we're going to bring Mel's arm to about an 80-degree angle from the 90 degrees formed with the IR. We then also alter the tube angle 45 degrees laterally to emphasize that coronoid process. Again, we're taking advantage of the elongation from the tube angle. We set our proper collimation, place our marker on the lateral border outside of the shadow of the anatomy of interest, measure, set technical factors, ensure that she is shielded by running through our stamps method before exposing. And we're back. We are continuing with the Coyle method, but instead of doing a seated position, we're going to be doing it supine with Mel here. So we do a supine Coyle method for the radial head when the patient has been in a previous trauma situation. So they typically will have lower leg concern for fracture or further fractures surrounding the body. So the patient will already come in on a gurney or in a laying down position, and you'll see that they won't be able to extend their arm as previously mentioned. So again, going ahead with the radial head method, the patient is in a supine position. The arm is going to making a 90-degree angle to the body, pointing superiorly. Part of the tricks that I have learned for this positioning from my text is to place a small sponge underneath the distal humerus to elevate the forearm and elbow further away to the center line of the IR. We are using a 10 by 12 IR for this situation. You run through stamps, ensure that you have the proper SID, 40-inch SID, the proper technique that we had mentioned earlier, alignment of the tube using a 45-degree cephalad angulation to elongate that radial head. So again, we are angled at the middle of the forearm elbow joint, just several inches in between from the olecranon process and the elbow joint crease. So you're using the epicondyles from the humerus to ensure that they are running perpendicular to the IR. Again, the 45-degree angulation running cephalic, thank you, Mel.
No problem.
What a great co-host she is. Elongates that radial head when there are concerns for fractures. So we're going to continue with the Coyle method, and this one is going to be focusing on the coronoid process of the ulna. So, similar to the previous supine position that we showed you, we are taking advantage of that tube angulation to elongate the coronoid process of the ulna when the patient cannot fully extend their arm. There are slight differentiations, though, between what we just showed you. This method, you can see that instead of the arm being at a 90-degree angle to the IR, we made an 80-degree angle, and that ensures that the coronoid process is not closed off. Again, we're keeping that sponge underneath the distal humerus so that we elevate that forearm and elbow closer to the midline of the IR. Another tip that I can give you is if the patient is having difficulty holding their arm up from in that superior position, you have the patient's other arm come around and grab this hand for stability. Thank you, Mel.
You're welcome.
And so, continuing, we are angling that arm at an 80-degree angle instead of the 90 on top of a 45-degree CR angle going caudally to elongate that coronoid process.
And we're back. So now I'm going to explain the evaluation criteria for the radial head with the Coyle method. So the first thing you want to be sure is that you have proper collimation, which is 6 by 6. The other thing you want to be sure of is that you have the proper marker placement, clear of any anatomy of interest. The next thing you want to have is open joint spaces between the radial head and the capitulum. Next thing you want to be sure you see is the radial head, the neck, the tuberosity in profile, free of any superimposition. You also want to make sure that you see the humeral epicondyles. They're going to be a little distorted because of the CR angulation. You also want to ensure that the elbow is flexed at a 90-degree angle. And the final thing you want to be sure of is that you have that bony trabecular detail and surrounding soft tissue.
Hi everyone. Again, we're here to go over the evaluation criteria for the coronoid process of the Coyle method. So the first thing that you would be looking for is, again, evidence of proper collimation and presence of a side marker. You want to look for that open joint space between the coronoid process and the trochlea. Again, that coronoid process should be in profile and elongated from the CR angulation. Radial head and the neck should be superimposed by the ulna, as indicated by that 80-degree angulation of the forearm. And of course, the elbow should be flexed about 80 degrees so that you open up the joint space for the coronoid process. Of course, everyone's favorite, you want to see bony trabecular detail and surrounding soft tissues. We want to thank everyone for tuning in to our episode of Radical Radiographic Positioning. Again, I'm your host, Alex.
And Mel.
And our wonderful cameraman, Roland.
And
we wanna
thank you to Charlie.
Thank you, Charlie. See you later.
Okay, now we're going to explain the evaluation criteria. I am going to tell you about the radial head criteria. Cut.